Dr. Lisa Dabby, thank you so much for joining me here on Heartquake. You and I are natives of Los Angeles, and our city is suffering through a massive heartquake or trauma of the heart. First of all, how are you doing as an emergency room physician on the front lines?
Honestly, my heart is broken. I'm devastated. There's no words to describe the pain and suffering that we're seeing. I'm trying my best to help everyone I can. I think we all as a community have to hold each other up at this time. My heart goes out to everybody who's been affected by the fires.
Tell me what you're seeing on the front lines. It's scary and it's daunting. And it's like my children will go outside and they'll say, Mom, I don't need an N95 mask because it's fine. No one's wearing one. Then what do we need to know about smoke inhalation and air quality?
So I think one of the most important messages out there right now is we really want to go back. Those of us who have lost homes want to go back to see the space to dig through the rubble, and we're going to advise you not to. The ashes are full of toxins, asbestos. It's better to prevent. Anybody who does not need to be there should not go. If you do need to go, which I understand, if you do feel like you need to go, you need to make sure you're adequately protected. Steel-toe shoes, hazardous clothing or protection, because we don't want any of your skin or your clothing to come in contact with the chemicals, gloves, N95 mask, goggles to prevent your eyes from getting exposed to the fumes. I would even cover your hair. If you're gonna go in, just cover everything with items that you could dispose of after. Because at the end of the day, we want to prevent exposure to these toxins and these chemicals that may cause long-term damage.
People are asking, when will the air be clean again here in Los Angeles? What can you tell us about that?
I think it's a fantastic question, and I don't know that anybody has the answer to that question. I think the key thing is to be vigilant and to be aware. If you see or smell smoke, you should be wearing a N95. If you see ash, you should not be exposed to the ash. You should make sure it's disposed of appropriately. I think it's important to move forward, but we have to do it safely. We have to take care of our long-term health.
We both have children, teenagers, and in elementary school. What can we do to help our children right now?
Yeah, I think it's a really hard time for everyone. And it's a balance of getting our children into some sort of normalcy. Children thrive with normalcy. So getting them back to school, getting them back to their activities, but doing this in a safe way. So hopefully your school is taking the precautions of putting in the MERV 13 HEPA filters. Hopefully they have cleaned up all the ash. Some schools are watching the air quality every day. If the quality is not good, kids should be kept indoors. If they come outside, they should wear masks. If the air quality is good, because it's going to change from day to day, depending on the way the wind is blowing, depending on the cleanup effort. So we have to be vigilant, I think, for the next few weeks, months to come while they're doing the cleanup, of watching these things and protecting ourselves, our children, our community. It's hard. How do you get back to life when it's not normal?
Can you tell us a little bit about what you're seeing in the emergency room right now in the kind of aftermath of the fires?
During the fires, we have seen some smoke inhalation injuries. We have seen some carbon monoxide exposures. We've seen people coming in with irritated eyes from exposure to chemicals. So we've seen kind of the bread and butter exposures to fire. Now that they're starting to get the fires under control, we're seeing a lot of the aftermath of people coming in. They're exhausted, they're stressed, they're dehydrated. Everybody has been just pushing themselves, whether they lost a home or whether they're helping other families. Exhaustion, dehydration, vertigo, stress, anxiety. There's a real psychological impact that we're going to see secondary to everything that's happening. And I think we have to be mindful. I think we have to take care of each other. I heard a statistic that after a disaster like this, suicide rates can go up to 30%. And it's really important that we are looking out for each other and that we're helping each other and that we're here to listen and support each other, because people have suffered very traumatic losses. Thank God not many people have died, but people have lost their livelihood, they've lost their homes, they've lost all their memories, and it's a real thing. And we need to find a way to support each other and be there for each other and raise each other up.
And I just want to thank you because you're not only on the front lines, a mom running your business, but you also opened your home up to family who lost everything. I know through my own healing journey of the heart that there's such a strong connection with the mind and the body. What can you tell us about that?
100%. People like to use the phrase psychosomatic, where when you're upset, you have stomach pain. Well, there's a real reason for that, right? When you're upset, your body secretes more acid into your stomach. The acid burns the lining and your stomach hurts. So these are not made up things. They're real things. Our body is so finely interconnected that it's important to take care of the whole body. And we're seeing a lot of that right now, right? People who are having anxiety-related complaints, people who are having stress-related complaints, and it's real, and we have to take care of the whole body. We have to treat the whole patient.
Now, I know there's this term broken heart syndrome. Are you noticing more heart events in the ER during this time?
I've definitely seen a large number of patients come in with chest tightness, chest pain, feeling like they can't breathe, and it's hard. It's hard to know, is this a real heart event? Is this feeling suffocated because we've lost so much? And as I said earlier, we always want to check the heart. We don't want to dismiss and say, oh, they're just panic or stress. We always want to do a thorough evaluation, check the heart, check the lungs, make sure there's nothing dangerous before we then potentially address, let's figure out how to decrease your stress or support you more.
You being a first responder on the front lines, what can the community do for you right now?
We're good. I think the biggest thing right now is to support our firemen.
Okay.
They are working around the clock. They're exhausted. They're heroes. They're out there every day. Everybody else is going back to their normal lives. They're still out there fighting these fires. So checking in with your local fire department. I know some have been requesting water, food, whatever they need. I think we need to support our first responder firefighters who are still out there fighting these fires.
Dr. Dabby, we're sitting here in my home that is still standing. Your home is still standing. What advice do you have, us both growing up here and seeing the devastation that's happening? Do you have any advice for our Heartquake community?
My heart goes out to everybody who has lost a home. There's no words, and I don't think any of us can fully understand the magnitude of the heartquake you're experiencing right now. My best advice is one day at a time. The community is here, reaching out with open hands, trying to support all of these families. One day at a time. Let's find a new place to live. Let's replace the clothing. Let's get the kids back to school. With time, all wounds should heal. Be patient. Let yourself feel the pain. Don't try to suppress it. Let others help you. Let us take care of you. That's the biggest challenge I'm having right now, is that so many people were affected and they're just shut down. They're so overwhelmed. It's okay to let people support you. Let us love you. Let us help you.
I love that so much because I've felt that as well.
These are the people who are used to helping others, and they don't know how to receive help. And it doesn't mean they're weak. It's not a pride thing. It's not a shame thing. This is devastating. So let us support you. Let us help hold you up in this time. You would do it for us. I have no doubt.
Dr. Dabby, thank you so much for being part of the Heartquake community. Please let us know, is there anything that we can do for you and the ER staff?
I want to thank you for all that you guys do. Heartquake is an incredible organization. You are educating and supporting so many women, so many people with heart disease. It's truly phenomenal, and I applaud you, and I hope that you can continue to reach out to millions and continue to share the love and the support and the education. The work you're doing is so important.